So the first question I ask you guys is, who has diabetes? But first off, you have to remember that there's two types of diabetes. There's type 1, the juvenile onset. Now this tends to be the people who need insulin right from the beginning. And then there's type 2, which is actually much more common. Happens usually later in life. Usually the onset is after the age of 40, but we are seeing more and more diabetes happening earlier on, even in children, of the type 2 diabetes variation. And that's part of the so-called obesity diabetes epidemic that we're facing. But type 1 and type 2 are very different diseases to some extent, although both are diagnosed and both are associated with elevated blood sugar. So a number of people indicated they have type 2 diabetes, and the vast majority of people do. But is there anybody here who has type 1 diabetes? Anybody here who's been on insulin right from the beginning?
I'm not, but my granddaughter is.
Okay, so you know somebody who has type 1 diabetes. So we know that that's a much more significant disease and that you need to be on insulin for the rest of your life. So as much as you can be doing what we call resistance training, building muscles, that's just as important. And actually, by the way, it's good for preventing osteoporosis. It can help with weight loss, but even more than weight loss, and just you'll feel better, you'll be less likely to fall.
Let's do that one time.
Aerobic's
Stand up.
good.
What's that? How would you do this?
Squatting, yeah.
There you go. Well, let's get rid of the squat,
The
everybody.
aerobic stuff is great, it's better than nothing, but if you can get some resistance training and also the intensity, if you can get some intensity, actually get your heart rate going, get a sweat going, 30 minutes a day, 4 or 5 times a week, that in combination with, tracking your walking and stuff is good as well.
So for those who want to fill out exercise prescription.